It's very disparate, and I think that's the key thing here. So you have the Gulf, the GCC countries, specifically where there is a lot of investment going on. Some within that actually have very good healthcare systems or are building very good healthcare systems. So if you look at Abu Dhabi or you look at Dubai, they are building better healthcare systems across the UAE. Bahrain has a decent healthcare system. You look at others, they're in transformation. So you look at Qatar, that's in transformation with a lot of investment. Kuwait in the same sort of way, a bit slower. And Saudi Arabia, which is also investing heavily. And then you come to some of the transitional economies in Iraq and Libya come to mind there, where there's a great will to do, and the budgets are obviously growing and investment is coming in, but there's a significant lack both of infrastructure and people. And I think the key for me is really around the people. It's about efficiency, people, process, if you'd like. And I call it that interesting triumvirate. But there's a lot of focus on building the infrastructure, which is right in some places. But the challenge is getting the right skills in the right place at the right time, and identifying how you can nurture some indigenous skills. So within your own population, how do you upskill your labor force to be across the spectrum of healthcare? So it's not just doctors, it's nurses, it's allied health workers, community care professionals, primary care physicians. It is across that spectrum, because without that whole spectrum, a health system doesn't function. Definitely better. I think there is a real push, particularly after the Arab Spring, a real push on focus for the betterment of citizens. So if you look at the social sector, education, health, I think these are the places where governments are going to continue to invest. They're going to look to be better, and I think the citizens are going to hold them to account to be better. Where we really see ourselves helping is around supporting them either in the development and how they create the primary care system. And I think we can play a part there in advising them on how they do that and how they build a system that's efficient and effective for its population, but also helping them at a more granular level, either within hospitals or within the healthcare system, about how they manage those services. So either by deploying some of our advisory capability on strengthening program and project management, performance management within that context. And I think that is where we've seen from these last 2 days here a real need, and I think the real recognition that needs to happen. The summit was very useful in understanding what the current situation is in Iraq, and while Ernst Young has been present in Iraq for numerous years, since 1923 we've been in Iraq. We've 2 offices in Iraq, in Erbil and in Baghdad. So we're very keen, obviously, to work in Iraq. But this is the first time from a health perspective we've come to focus on healthcare. And it has given us a very good indication of what the magnitude of the challenges that the country faces, but also how we can start to play a role within that, and where we can strategically target what it is we want to do with them. What the whole forum enabled us to do is meet the right people, and I think it was a very effective way of us connecting with a number of decision makers, but also a number of different players and delegates to get a quick view of the landscape. And I think that was one of the key purposes of coming for us, was to get a good view of what the healthcare landscape looked like, and we've managed to do that quite well in the last 2 days.